My name is Aysha Ali and I'm the Training and Quality Officer. I work with the Berkshire Clinical Team and I also work for West Northamptonshire Council. We will receive referrals from GPs, hospitals, AGL coordinators. So how it typically works is it will come through a mailbox. We would then enrol that patient onto the Docabo system. There will be an initial phone call from one of the clinicians to the patient to see that they're comfortable of how it works and what to expect. Based on that, we would arrange for the installation team to attend. They would take with them the Docabo tablet. They would take with them a blood pressure machine, an oximeter and a temperature machine. And what we do within that installation is go through each device on how to use it. We would then go through the Docabo tablet and show them how to utilise it and input their data onto the system. We would do that with the installation officer on site, and then we'd do it again with the patient doing it themselves. We would also, if we can, do a test of video call to ensure that they know what to expect when a video call comes through. What we would ensure is that the patient is comfortable in using the tablet. We would give them a pamphlet where they would know a quick guide on how to use it. And we would also check in on the patient after, say, a week to see that they're submitting the information correctly and if they needed any assurance. Sometimes some people aren't so great on technology, but they just need that added help. And it's sometimes just a call. But if they are feeling kind of sort of anxious, we can arrange for another AT officer to attend, just to give them another sort of run through of how it works. And if that means having another family member on site, we would do that too. We try to accommodate as we possibly can do.
Hi, my name's Rod.
Okay. Alright, and my name's Tracey. I'm Rod's carer, and Rod's been on the COPD monitoring service since he came home from hospital in November. Before remote monitoring, Rod was in hospital for 10 weeks. And one of the things is that we had care on hand, questions we could answer the staff at that point in time. So, and that was a concern of coming home, that we didn't have that environment and those qualified staff to ask if something happened really quickly. And I was really nervous about having to make appointments with the GP surgery, knowing the pressure that they're under. And sometimes with Rod's condition, it could change day to day.
Hour by hour.
Hour by hour. So before remote monitoring came in, anxiety was very high, and I don't think Rod or I would have been able to be in a position for Rod to come home without having this service in place. They can give suggestions to, can you ring the GP, go to the out of hours clinic, or we'll monitor it and call you back in the morning. They're always very reassuring. They will, and also that they will take away and send, right, that's great information, we will pass that on to the GP, and remote servicing have got the GP to ring us the following day, which again, it's just that confidence that it gives us to be able to manage the condition while being at home.
I suffer with anxiety and have done for years. I don't have to worry. 2 hours and there'll be somebody on the phone or here, and that's a big comfort,
The key benefits for this service most definitely is the contact and the clear communication that you can have with clinicians, because you're always going to have the 999 service, the 111 service, but this is another way. So should they want to get reassurance or have that sort of connection with a nurse, they can do that. You can message the clinicians using the texting service. We've got things like the video calling, which is a first. And even when you're submitting the question sets, based on what the questions are, your answers are, you are going to get a contact from one of the clinicians. So that's the reassurance that they have that there's somebody there between that core hours of 7:30 and 11:30 at night.
I would recommend it to anybody that was in need or having to see the doctor every day, but make up phone calls and all that sort of thing. That's gone. Because I know these people are expert and they will tell me, get in touch with your doctor, Rod, straight away, or we need to do a 111 call or whatever it is. it's all took care of.
Yeah, I think absolutely the advice to give to anybody thinking about this or being offered this service is take it from a confidence, a reassurance. It allows you to carry on with your life, have the confidence to go out for the day because you know you've got that point in the day where you can upload Rod's observations, and it's just that comfort factor, it's just that absolute reassurance that you've got somebody there knowledgeable and reassuring to be able to tell you everything, you're doing okay.
It's revolutionary, definitely. It's a service that I would definitely recommend to other organisations. It's I think we're the first CQC registered hub, virtual hub, which is fantastic in itself for Northamptonshire. I think if utilised correctly, I don't see why it wouldn't be rolled out across the board nationwide. I always say this whenever I'm trying to explain it correctly of what the usage of the Stockbow system is that unfortunately my mum passed away in 2016, but had she been alive, this would be something that I would want her to have, because the ability to submit your readings, which might seem sort of not really much, but it is for chronically ill people where they know that if they've submitted some information, that's going to a clinician who's able to read it correctly and get the help that they would need. Otherwise they'd be left days and weeks of not sort of bothering people, bothering someone or their GP or the consultant, and then until unfortunately it becomes a little bit too late. So that's the reassurance and what I let people know of how it works and what the advantages are.